Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at the fractures as well as dislocations. So fractures and dislocations and the associated nerve injuries. Nerve injuries. So first is we look at the fracture of the clavicle. So in terms of the fracture of the clavicle, there is the nerve injured is the brachial plexus. So fracture of clavicle is going to be the brachial plexus. Next, moving on to the anterior and the inferior shoulder dislocations. So anterior as well as the inferior shoulder dislocations. So here what is involved? It is nothing but the axillary nerve. So it is nothing but the axillary nerve that includes the circumflex humeral, to be specific circumflex humeral. Next, the proximal humerus fracture. So the proximal humerus fracture. So proximal humerus fracture, it includes the axillary nerve, the proximal humerus fracture, axillary nerve. Next, the shaft of humerus. So in case of the shaft of humerus, the shaft of humerus fracture. So shaft of humerus fracture is the radial nerve. So shaft of humerus fracture is the radial nerve. Next, moving on to the supracondylar fracture of the humerus. So in terms of the supracondylar fracture of the humerus. So supracondylar fracture of the humerus, it includes the AIN. So here there is a sequence that is AIN greater than the median nerve, greater than that of the radial nerve. So AMR is the sequence. So this is the supracondylar fracture of the humerus. Next, moving on to the medial condyle of the humerus. So in case of the medial condyle of the humerus, it is the ulnar nerve which is involved. And in case of the posterior dislocation, the posterior dislocation of the elbow. So posteriorly dislocation of the elbow, it results in the injury to the ulnar nerve greater than that of the median nerve. Next, there is a named fracture, that is Monteggia fracture. Monteggia fracture is it is present. It's near the elbow, and it involves the proximal radius and the ulna. So that particular region. So here the involved nerve is the pin, that is a posterior interosseous nerve. Next, we move on to the Walkman ischemic contracture. We are writing it as WIC. So under WIC, it is the AIN. So Monteggia fracture is the PIN and WIC is nothing but the AIN. That is the anterior interosseous nerve. Then moving on, we look at the hook of Hammett. The hook of Hammett. The hook of Hammett is Hammett fracture. This is the deep branch. So this is the deep branch of the ulnar nerve. So this is nothing but the deep branch of the ulnar nerve. Then comes the lunate dislocation. So under the lunate dislocation, it is the median nerve which is involved. So under the lunate dislocation, it is a median nerve which is involved. Then comes the wrist injury. So under the wrist injury as well, it is the median nerve which is involved. Next, looking at the posterior dislocation of the hip and the anterior dislocation of the hip. So we talk about hip dislocation. So one place we have the anterior and one place we have the posterior. So first let's look at posterior, because in case of posterior, it is the sciatic nerve which is involved. And then when you look at the anterior, this involves the anterior and also the shaft of the femur. So both share a similarity, and shaft of femur fracture. So both of them, the involvement is the femoral nerve. So in case of posterior, it was a sciatic nerve. In case of anterior and the shaft of femur, it is a femoral nerve. Next, moving on, the knee dislocation. So in case of the knee dislocation, it is the common peroneal nerve which is involved. Common peroneal nerve which is involved in case of the knee dislocation. Then moving on to the proximal tibial fractures. The proximal tibial fractures. The proximal tibial fractures and also the ankle injuries. So in both cases, it is a posterior tibial nerve. So what is involved? The posterior tibial nerve is involved. So proximal tibial fracture and the ankle injury, the posterior tibial nerve is what is involved. Then moving on to the fracture neck of fibula. The fracture neck of fibula. So in case of the fracture neck of fibula, it is a lateral popliteal nerve. So there is lateral popliteal nerve. So the fracture neck of the fibula, there is lateral popliteal nerve. That is the common peroneal nerve. From the common peroneal nerve. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.